Hello, hi there, Dr. Sean Hill here at Lone Star Plastic Surgery, coming to you live from my office. We are actually here today because we are about to launch our own YouTube channel, which you might say to yourself, Dr. Hill, why do you need a YouTube channel? You're not one of those dude sweet guys. Is that what they're called, Brooke?
Something like that.
Something like dude perfect. I'm not one of those guys. But you know what? I'm going to have a YouTube channel because why am I going to have a YouTube channel? Because we need to provide with some edutainment, if you will, some education regarding plastic surgery, cosmetic surgery, as well as entertainment. And so that's what we're here for. So that's what the purpose of the YouTube channel is, and this is the first video in the line of that. And you know, while we were brainstorming about why should we do, or what's the first video for our YouTube channel, you know, I was going to do something like, you know, The Godfather or Goodfellas. Brooke said, Dr. Hill, those are all well and good, but the best thing that we can do for our YouTube channel is a video getting to know you. Which I felt like, you know, I'm pretty sure that Michael Corleone has nothing on me, so this is gonna be awesome. So here we are, Volume 1, Stage 1 of the YouTube channel for Lone Star Plastic Surgery, and this is called Get to Know Dr. Hill. Now, in the director's cut, there will be a little title that goes across the screen there that says Get to Know Dr. Hill, so just pretend you saw that. There we go. All right, so Brooke has had many questions here from all of our followers, the fan mail that we get here at the office, and so she's going to pose them for us right now so that way I can answer them for you. So Brooke, go right ahead. I'm an open book to you.
All right, Dr. Hill. First of all, everybody wants to know where are you from? Where does Dr. Hill originate?
Dr. Hill is from a cornfield. Much like the story Superman, I'm from a cornfield in southern Illinois, about a small farming community called Jerseyville, Illinois. For those of you that want to map it right now, we're about 50 miles from St. Louis. So it's a farming community with a bunch of cornfields, dairy cows in the middle of the streets, tractors coming down our two stoplight streets in here, Jerseyville, Illinois.
That's quite lovely. Why'd you decide to leave?
Well, you know, I left there to do college in St. Louis because I wanted to kind of go to the big city. So I did college at St. Louis University there in St. Louis. Then went from there to medical school at the University of Illinois. Did that in Peoria, Illinois, where I did that and general surgery, and then relocated to Texas here to train at the best plastic surgery program in the world at UT Southwestern in Parkland. After settling in there, I decided that I loved DFW and didn't want to leave.
Nice. So why did you decide to become a plastic surgeon?
Brooke, that's a great question. I'm glad you asked that. Why did I want to become a plastic surgeon? Well, it's a funny story. I actually entered into medical school wanting to be a family medicine doctor because growing up in small town USA, that was the only doctors we really had back there. And so I thought to myself, I liked the idea that I was the family doctor taking care of people's needs throughout their entire lifetime, solving problems, being a part of the community and those things. And I entered my first month of medical school hell-bent on being a family medicine doctor. And there I sat in the anatomy lab and I said to myself, this is amazing. Human anatomy is the coolest thing in the world. And I knew then I had to be a surgeon. And so that's kind of where I decided upon surgery. And then I was speaking with a mentor there at the University of Illinois, and she said, she knew my backstory. So a little backstory about me is, you know, my dad's was an engineer. And I actually went into college thinking I was going to be an engineer like my dad. And then the medicine bug kind of bit me. And I decided I wanted to go to medical school. And then the other part of my background actually is I've got two older sisters, both of which are in the arts. One's a dancer, one's a writer. And then whenever I went into college, I was actually, hard to believe because I'm so bashful, was actively involved in our theater scene. So I was on stage productions of that, as well as an appreciator of the arts. And so speaking with my mentor who said like, oh, you know, Sean, you like engineering because you like to take puzzles, take things apart, put them back together, move shapes around, and the creative thinking of engineering, and then you like the arts. She said, why don't you check out plastic surgery? It's a perfect marriage of the two. And so the first case I saw was a cleft lip and palate actually. And so watching the kind of the surgeon work and making the shapes change there, I could see the aspects of engineering that I loved, but I also loved the aspects that, you know, he made a difference in this child's life for essentially the rest of the child's life and was involved in this family, much like a family medicine doctor would be. So for me, I thought it was a perfect fit. So here I am, plastic surgery.
Awesome. So you said that you almost went into the arts.
Yes.
What other hobbies do you have outside? Are you still involved in the arts?
Oh, I am actually, Brooke. That's great that you mentioned that. Yeah, you know, obviously I'm an avid supporter of the arts here in Frisco. I'm a patron of the Frisco Fine Arts Society. I take part in their 5K runs every year, usually besting the best athletes out there. I do love going to art museums. This past weekend, I was actually at the Kimbrel in Fort Worth, seeing the new Monet exhibit. And unfortunately, I'm not doing any theater at this point in time. You know, medicine kind of takes a lot of my calendar, but I would not be opposed to take a starring role somewhere on Broadway. I guess if they were to call and ask, I probably would say yes. So and also, if you're watching there, Martin Scorsese, you can just give me a holler. I'll come out and I'll be in one of your movies. It'd be cool.
That's awesome. Do you have any hobbies?
Oh, other hobbies, you asked me that. So my other hobbies would be, I'm a huge sports fan from St. Louis area, so I grew up loving the St. Louis baseball Cardinals. And so I'm a huge baseball fan, but also kind of a fan of any sports in general. Football, I've kind of adopted the Dallas Cowboys. It's hard not to, being in Frisco. And then my other hobbies, I love seeing movies. I love going to movies almost every weekend. I'm also kind of a huge foodie, if you will, and a winey kind of person. Not whiny, but I enjoy fine wines and things like that. So it's kind of my other hobbies outside of medicine and outside of the arts.
So baseball or football? You mentioned both.
Baseball. It's not even close. Brooke, if the Cardinals win or lose, it almost makes or breaks my day. Whereas if the Cowboys lose, I would be sad, but I would not lose as much sleep over it as I will the Cardinals.
I'm a football person myself, but I do enjoy some baseball. Do you have a secret talent?
I mean, all my talents are pretty much public. I mean, obviously, Brooke. Little known fact. I mean, I have so many talents, but little known fact is I'm actually an amazing karaoke singer. Amazing.
Oh, really?
Maybe the best. Pretty damn good though. So I'm kind of the triple threat: actor, singer, and dancer.
I'll take your word for that.
It's public. You can see it now.
So why did you decide to open up a practice in Frisco specifically?
Great question, Brooke. Great question. So obviously, I trained in Dallas at Parkland and UT Southwestern, and I loved Texas. I loved DFW. Knew I wanted to stay in the area. And being from kind of small town USA, I didn't really necessarily want to settle into Dallas proper, just because it wasn't really how I like to kind of live. I wanted a little bit more of a little bit laid back area. And so looking at kind of the suburbia, I felt like Frisco was kind of the perfect mixture of big city, because we have all, Sports City USA with the Cowboys and all of the other teams up here. And we also have kind of a burgeoning city on our hands here, if you will. But we also have a small town feel. Every little neighborhood in Frisco is essentially its own little community. And so I felt like it's kind of the perfect marriage of both. So here I am, Frisco, Texas.
I do love Frisco, Texas. It is a very inspirational city. Who inspires you?
Oh. Good question. Growing up, it was my father. I wanted to be just like him. He was like the smartest person I knew, and he could do no wrong when it came to engineering and whatnot. And I idolized both my sisters growing up. They're quite a bit older than me, so for me it was seeing kind of their achievements in school. It's what I aspired to be. But then when I kind of entered the medical world, obviously we all kind of have our mentors in our specific fields. But my mentor probably, I have several, but one, Dr. Glenn Jones back in Illinois, as well as Dr. Eric Elwood. They're both passionate about their craft. They taught me plastic surgery, and just watching them work, it's an inspiration. And then moving down to Dallas, I had met several mentors while I trained at UT Southwestern, so they all kind of inspire me to be the best surgeon that I can be, if you will.
That is amazing. I didn't know that about you, so that's pretty cool.
Well, there you go. See, we're learning today, Brooke. Learning.
What is one of your favorite in-office procedures?
In-office procedures. Oh my gosh, we do so many. As you know, Brooke here. Obviously the most common is Botox, which is kind of fun to play with, which is fun, but I think I don't enjoy it as much as others because it's not an immediate thing. I think fillers are really fun. You be artistic. You can create things. You see an immediate result right there in front of your eyes. But I also kind of enjoy some of our other non-invasive procedures like microneedling and skin tightening things, because I know that they'll deliver results that are great for our patients with essentially almost no downtime. So those are fun as well. So the answer is all of them.
What is one thing that you look forward to this next year with our practice?
Well, it's great. Thanks for asking that. We actually are growing. Our 1 year anniversary is coming up soon, which is it's surprising because it kind of snuck up on me. This first year it's been an adventure, and I think this next year it's only going to be greater. We've got kind of a bevy of patients here that are part of our practice, and I like to look forward to growing the practice both in our number of patients as well as just kind of getting more involved in the community. I think that I'm doing some great things this year personally. I'm going pink in October for cancer research. I'm also kind of getting more involved with the arts as well as other local societies. So I think it's going to be Lone Star Plastic Surgery takes over Frisco and then also takes over the world.
Alrighty, here's a big question.
Okay, hold on. Let me sip some coffee for this.
What is one thing you can't live without?
Well, obviously coffee. Well, two things. Obviously oxygen is number one. I'm just kidding. Probably coffee and my iPhone. Everyone loves their iPhone. I think I'm kind of attached to both that and a cup of coffee almost 24 hours a day.
I can attest to that.
Yeah, true story.
Alrighty, last question here. Do you have any advice for anyone who's interested in getting plastic surgery?
Do your homework. There are a lot of people that fancy themselves a plastic surgeon, cosmetic surgeon, injector, whatever, and some people are a little bit more, I won't say qualified, but more are trained to do the things that they're doing. So just do your homework. Don't just fall for a shiny website or a smooth talk. Or you need to do your homework, kind of see what someone's credentials are and see kind of what they're all about. But also I think another important thing for plastic surgery or surgery in general is it's a very intimate thing, and so you should need to make sure that you meet with people and find someone that meshes with you, because heaven forbid something happens, you want someone that you trust along that journey, so that way they can guide you to the best treatments possible. So I think I got there.
Alrighty, we've had a wonderful conversation with you today. We learned a lot, and is there anything else you'd like to say before we sign off real quick?
No, Brooke, I think these are great questions. I think, I'm excited for kind of the YouTube channel. I'm excited for the year to come. I think it's going to be great here for Lone Star Plastic Surgery. So thanks so much for tuning in. We'll have some more videos. We've got more things on the horizon with this channel. So thanks again, Dr. Sean Hill, Lone Star Plastic Surgery. See you later.